One myth about midwifery that I would like to bust is that we're not full medical providers, because we are healthcare providers. We're not just hands-off. We're not just recognizing the beauty and the normalcy of birth. We are also there to keep people and their babies safe and to recognize, those pink flags and to get things back on track. So, we're there. We might be standing in the corner watching and witnessing the beauty, but we're also watching for signs of concern and reasons that we might actually need to intervene. And I think that people don't realize that so much of the job of a midwife is to keep everyone safe.
There's a common myth that midwives don't do any type of intervention, that we're just, it's kind of a free-for-all. If something bad happens, there's nothing that we can do about it. And, that's simply not true. One, in the state of Florida, midwives are educated, we're licensed, we have the education and the training and the experience to handle the majority of complications that can come up for low-risk pregnant women. Of course, high-risk women we refer into the hospital setting and into physician care. And then even doing risk assessment and risk screening throughout pregnancy, we're able to make sure that the families that come to see us are good candidates for our care. And, we have the things, we have tools, we have the experience, the knowledge, the skills to be able to take care of those common complications that can happen in a normal pregnancy, labor, and birth.
Ultimately, there's still this belief that we're joining you in labor and we're praying and we're telling you you're doing such a great job. And you forget, even in home births, that we're coming in with 3 suitcases worth of oxygen, life-saving medication, resuscitative equipment, that we're providers that go through 3 years of academic education and between 3 to 6 years of hands-on learning before we can sit for our exam. And it's really, really intense. There's so much education, and it's also consistently learning and being open to that, reaching out, paying attention to new studies as they're released so that our clients are getting the most up-to-date care. And so it's far beyond I'm gonna show up, tell you you're doing a great job, put a Doppler on your belly, tell you your baby sounds great. And sometimes that's what it looks like, which is really, really great. But sometimes it doesn't, and that's why we're so prepared and we're so educated to just have the ability, when it's not that picture perfect butter birth, we're here to keep you and your baby safe.